Placement of a central venous catheter. When placing a central venous catheter, it is important to pay special attention to these critical moments to prevent infections. First, prepare all necessary materials and thoroughly disinfect your hands. Position the patient according to the planned puncture site. Now perform skin antisepsis, ensuring that a sufficiently large area is covered, that the area is completely wetted, and that the prescribed contact time is observed. Then, disinfect your hands again. Put on a sterile gown and sterile gloves and prepare the sterile work area. Cover the patient with a sterile drape. An ultrasound device should also be used for catheterization. The transducer must also be disinfected. The transducer and connecting cable must be covered with a sterile cover. The ultrasound device must also be disinfected to protect the patient. When performing ultrasound on the puncture site, an alcohol-based hand disinfectant must be used as the coupling agent. Now, perform the catheterization. Next, apply a sterile dressing to the puncture site and secure it carefully. Dispose of all used materials properly, remove your gloves, and finally, disinfect your hands and all contact surfaces. Infection risks arise not only during the insertion of a central venous catheter, but also during its continued use, for example, when manipulating the hub or changing the dressing. Therefore, ensure consistent adherence to all hygiene measures throughout the entire duration of the patient's hospital stay. This includes regularly reviewing the indication for the catheter, thorough hand disinfection, and aseptic technique, for example, when applying a sterile dressing using the non-touch technique. Effective infection prevention does not end with the insertion of the central venous catheter. It extends throughout the entire life cycle of the catheter, from insertion to removal.